Hey everyone, so in the first part, we dealt with the introductory part to blood transfusion. In today's video, we will discuss about the selection of donor for blood transfusion and different components and its indication. So donor selection is done on the basis of donor history and risk factor assessment, infectious disease testing, ABO and RH typing, and cross matching. So for the donor's history, general physical examination should be done, and the general appearances should appear normal, and patient should appear in good health. The age of the donor should be between 18 and 65 years. The weight for 350 ml blood collection should be 45 to 55 kgs, and for 450 ml collection, the donor's weight should be 55 kgs and above. The temperature should not exceed 37.5 degrees Celsius or 99.5 degree Fahrenheit. The pulse rate should be between 60 to 100 beats per minute, and the blood pressure should range between 100 and 160 millimeter of mercury for systolic blood pressure, and for diastolic it should range between 60 to 90 millimeter of mercury. The skin should be free of any skin lesion or any infection. The medical history of the donor includes that the donor should not have malaria for at least last 3 months. He should be jaundice free for at least last 1 year. If the donor presents a history of HIV, HBsAg and SCV antibody positivity, then the donor is permanently deferred. Intimate contact with HIV, HBsAg and SCV antibody positive individuals are deferred for 1 year. Donors with history of measles, mumps, chickenpox are deferred for 8 weeks, and donors with history of influenza are deferred till 1 week after treatment. Coming to the history of vaccination, the vaccination against TB, TT and cholera and hepatitis, the donor is accepted if he or she is symptom free. Donors with hepatitis B vaccinations are accepted after 7 days of vaccination, and donors with vaccination of yellow fever, measles and polio are deferred for 2 weeks. Donors with rabies vaccinations are deferred for 1 year, and those bitten with any animals are deferred for 1 year, and donors with hepatitis B immunoglobulin should be deferred for 1 year. No donation of blood should be accepted from women who are pregnant during their period of pregnancy and till 12 months after their full term delivery, and also during the lactation. Donors having history of ingestion of aspirin or any related medicine within 3 days prior to donation should preclude use of donors as a source of platelet preparation. Donors with history of major surgery are deferred for 1 year after the recovery. With history of minor surgical procedures are deferred for at least 6 months. The laboratory examination of the donor should include hemoglobin of not less than 12 grams per DL and hematocrit of not less than 36%. The infectious disease testing should be done with donor. Hepatitis B, HBsAg and anticore antibody testing should be done. Hepatitis C antibodies should be done. HIV-1 and HIV-2 antibodies. HTLV, that is human T cell lymphotrophic virus 1 and 2 antibodies. Serologic tests for syphilis. Nucleic acid testing for HIV and SCV should be done. Detection of bacteria and platelet products should be done. And cytomegalovirus antibodies should be done. The cross-matching was discussed earlier in the part 1, so you can go and watch the video by clicking on the link given in the description box. So we'll skip to the components of the blood. So before we go to the different components and their indications, we need to get well versed with few terms here. First one is apheresis, which refers to the process of separating the cellular and soluble components of the blood using a machine. The apheresis is often done on donors where whole blood is centrifuged to obtain individual components such as RBCs, platelets, plasma based on specific gravity to use for transfusion in different patients. The selective collection of RBCs, WBCs and platelets is called as cytopheresis, and selective collection of plasma is called as plasmapheresis. The blood products can be divided into 3 components. The cellular component, which includes red blood cell, platelets and granulocyte concentrate. The plasma components, which includes fresh frozen plasma, cryoprecipitate, poor plasma and stored plasma. The plasma derivatives includes albumin, immunoglobulins and coagulation factors. The banked whole blood is the one in which no components have been removed and contains RBCs, WBCs, platelets and plasma. It can be stored for 5 weeks, and transfusion of whole blood are rarely required. They might be necessary in cases of acute blood loss, as in cases of major surgeries where blood loss is more than 15%, and it is also a poor source of platelets and clotting factor 5 in it. The second one is packed red cell. The red cells from the donor unit diluted with plasma to a hematocrit of 75%. So it is a red cell from a donor's unit diluted with plasma to a hematocrit of 75%. The volume is about 200 ml, and storing red cells just above freezing allows survival for about 42 days, and it is the product of choice for most clinical situations for transfusion. The indications for packed red cells are: in OMFS, a red blood cell transfusion is occasionally required during double jaw and oral cancer surgeries. And in the field of surgery, transfusion is performed for the purpose of oxygen transfer to hypoxic tissue and plasma volume expansion when there is bleeding. It is used for patients with acute anemia caused by perioperative bleeding. It is also the fastest way to increase the oxygen carrying capacity of the blood. A unit of RBCT will increase the hematocrit by 3% and hemoglobin by 1 to 1.5 gram per dl. Next, we have frozen red cell. The concentration of red cells preserved frozen at minus 80 degrees Celsius. It reduces the risk of transfusing antigen or foreign bodies that the body might regard as potentially dangerous in previously sensitized patient. The drawback is that it is not available in emergency situation, and the advantage of frozen red cell is that the RBC viability is improved. The platelet concentration is the next, which is composed of platelets and 50 ml plasma. It contains cellular components that help in the clotting process. Platelets can be stored up to 5 days in room temperature. It is indicated in platelet disorder and when there is massive blood loss. So 1 unit of platelet concentration will usually raise the count to 5 to 10k microliter. Next, we have fresh frozen plasma. It is obtained from freshly donated blood and it is source of vitamin K dependent clotting factors. It is the only source for factor 5. It is indicated in coagulopathies and different clotting factors. 1 unit of fresh frozen plasma will result in 3% increase in clotting factors. The cryoprecipitated antihemophilic factor, it is an antihemophilic concentrate cryoprecipitate which is produced by allowing fresh frozen plasma to thaw slowly at 1 to 6 degrees Celsius. It is prepared from plasma and rich in clotting factor, used in people with hemophilia and von Willebrand disease or other major abnormalities to control bleeding. Its contents are major portion of factor 8 and fibronectin, which is present in freshly drawn and separated plasma. It is indicated where there is need of repletion of fibrinogen levels, activation of platelets, a replacement of factor 8, von Willebrand factors, and factor 13. So there we come to the end of this video. We'll see you in the next video. Until then, bye bye and take care.